All right, it's 2 o'clock, so I am going to get started. I have a few housekeeping things to take care of. Welcome to ProCon and this session, Aquatics Resources for your JCC during COVID. My name is Jordan Lanziski, and I'm the Deputy Director of the Experience Team at JCC Association of North America. This session is being recorded, and we understand that some people don't wish to be recorded, in which case you may turn off your camera, but we do encourage everyone who's comfortable doing so to stay visible so that we can feel as if we're all together. This is not the session you intended to join. Please return to Spot Me and select a different session. My name appears as the host at the top of your participant list, and you can use the chat to message me to address any needs or questions you might have. We aspire for every person to feel they belong at ProCon 2021 and are working to build inclusive spaces in which all people feel welcome, respected. So we invite you to rename yourself in Zoom with your name, agency, and if you're comfortable, adding your preferred pronouns. We've enabled closed captioning, and you have the option to turn it off using the button on the bottom toolbar. Please reach out to me in chat if there's anything we can do to enhance your learning experience or if you're having any trouble. We're thrilled to offer this multifaceted conference at no cost to our JCCs, which was made possible because of the very generous sponsors. Each sponsor believes in the JCC movement and the incredible work that JCCs accomplish day in and day out. Their representatives are proud to be with us to share their expertise and offerings, and we hope you'll join us in showing appreciation for their support by visiting their virtual vendor hall booths. And we also encourage you to connect with them anytime during ProCon and beyond. During the conference, you can use the chat feature to connect with them on the Spot Me platform. And after the conference, reach out to them using their contact information that's listed. Today's session will review the resources available for aquatics professionals, both during COVID and as members return to the facilities. So I would like to throw it over to Seth Hazen, Chief Wellness Officer of Peninsula JCC, to introduce our speakers today.
Great, thank you. And thank you everybody for joining our session today. 2020 brought all of us new challenges and opportunities. This session will review the resources available for aquatics professionals, both during COVID and as members return and facilities reopen. Gwen McNamara, Northeast Aquatics Manager for the American Red Cross, will share resources available to help with decision-making related to lifeguard training and safety protocols. We'll also explore the new Learning Center and ways to engage staff and community members with online courses that consider COVID guidelines. Participants will also hear from JCC professionals about innovative programming they're running in their facilities and how the programs can be replicated in other JCCs. Gwen has worked in aquatics for over 35 years, helping others in their quest for success. She spent 25 years of her career in aquatics management in Chicago, New Jersey, and now in the Adirondacks region of New York. Gwen began in the aquatics industry as a lifeguard, swim instructor, CPR instructor, and lifeguarding instructor. For the past 7 years, she has been the Northeast Aquatics Manager with the Red Cross. Gwen is currently earning her master's degree in organizational leadership and strives to help others identify and meet their organizational goals. She has extensive experience with nonprofits, indoor aquatic facilities, and staffing. Welcome, Gwen, and take it away.
Thank you. It's always so strange to hear like your own bio in front of yourself. It's very strange. All right, so thank you guys. Great to see some names for all of you guys. So thank you guys for joining us. For those of you who don't know, I drink tea all day for my voice, so please forgive me if I do that, but I'm gonna share my screen. And let me share, there we go. And let me, if somebody can give me a thumbs up when you can see that, because it shows up a little strange for me. There we go. All right, thank you, Jordan. All right, so we're gonna go over a few things and we'll go through it quickly. And by all means, I know Jordan said she would monitor the chat for me. So if anything comes up, we can go ahead and ask those questions. I won't have all the answers, but hopefully I'll be able to provide some direction and some guidance to consider. So this is me again. So I cover the Northeast, but regardless of where you are in the country, if you do have a question and you're not finding your answers, my contact information will be at the end. And you guys can always reach out to me and I will help make sure that you get to the resources you need to get the answer that you need. So we will go from there. So today we're going to talk about the new Learning Center, not only did 2020 bring COVID, it also brought where the Red Cross moved from Saba into the Learning Center. So we understand that there are some people that are still in transition of understanding those differences. So we're going to go over that. We're going to go over some of the COVID resources that are available, some things to consider for lifeguarding options, some of those toolkits and available resources, and class posting service, which is really, really important as we go forward. So the Red Cross Learning Center replaces Saba, Instructor's Corner, and our class posting page website. So it replaces all of those into one unified location. And I was around before Saba. I know the challenges of Saba. I know the challenges before Saba. This doesn't solve all of the issues, but it does solve a lot of them. So from here, you can go to one location and you can enter your course records. You can get your teaching materials. You can connect with the TSC. You can connect with the Red Cross store, and you can look for Red Cross training and posting on CPS. You can do all of it in one location. So it really does have some really strong benefits of a unified location instead of 4 to 6 different websites you have to attend. It's broken up into 3 different sections. And the student portal, and a lot of you guys, if you're year-round facilities, you might have looked at it, but I'm hoping I might be able to show you maybe a couple things you didn't know that the Learning Center does. So the student portal allows them to launch their online content, access their digital course materials, view their certifications, link to the store to purchase any supplies that they need, learn about the science behind what they're learning, and find out other information as well, and get help from the support center. So those are all from the student perspective. We also have where a lot of us have where the instructor portal, and that's where the instructor can do everything that the student can do, as well as enter course records. They can also get a history of their teaching that they've done in the past. They can get their materials for any classes they're teaching. They can manage their certifications as well. So they can view it, they can take their online recertification assessments. They can also stay abreast of the latest information with the science. They can network with other instructors. The iConnection is still there in news. So it's all in one location, and that's what the instructor can do. The only thing the instructor really can't do is be able to see what other instructors at their organization are doing. That is available via the partner portal. There you go. That's my human life. Sometimes my words get juggled. So in our partner portal, somebody is an administrator for your organization. From there, they can add and unaffiliate an instructor from your organization. You don't have to do that through TSC. Somebody still has to look at it, but you don't have to sit on hold waiting for that to happen. You can request it and you can do it. You can also view what your instructors have done that are attached to your facility. You can also check their certifications. You can manage your classes. You can enter course records for your staff. You can set up the blended learning. You can view the online course completion status, close out classes, enter classes on our class posting service, register for Learn to Swim, all of those other things as well. And you don't need to be an instructor in order to have these rights. So if you have your billing person wants to handle entering the course records in order to pay, they can be set up as an administrator in order to be able to do those things. So there are lots of things that are able to be done based on the different tier, but it all goes to the same location, and it's your email address is your unique identifier in our system. So those people who have had multiple emails over the years, this is a really good opportunity to go in and make sure to clean it up so that all of your records are under one unified email address. Whether you choose that to be your work email address or your personal is an individual choice. But if you do change your work email, you would have to make sure to change it here because we won't know, right? So really important things on the Learning Center. When you first log on to the Learning Center, there is an orientation class that walks you through how to a basic open house of the Learning Center, which is great. The other thing that we've really done is we've added under the resources videos and documents on how to do almost everything on our Learning Center. And when you go to enter to do something, if you're not sure what to do, in the upper right-hand corner, there may be a link for the document and the video, so that will walk you through how to complete that process, whether that is entering a course record, creating a blended learning class, registering for Learn to Swim. So you can look for those resources. We've tried to make it as user-friendly as we can. You can also download all of your updated instructor and instructor trainer materials. You can access your account affiliations, because we do know some people are attached to lots of accounts and you may not be there anymore. And a lot of what we're here today for is to review those COVID guideline page that we have available for anyone. So I've added a few helpful links here that are available in addition to what we'll be going through. So on the Learning Center, some of these things are available right through there and you can access it. And again, Jordan does have this deck, so it will be available. So on the Red Cross Learning Center, we do have the COVID page. We do have our aquatic support forum during COVID-19, and that is in our forum section, and that is where you guys as instructors and partners and all of those, everything other than students, can log on and go in there and get information both from your peers in terms of what they are doing, and our product team also moderates that and helps with making sure that the correct information is going out. So again, we have a whole separate section specifically for aquatic support during COVID. We have information with regards to our OSHA's good faith guidance, which has to do with CPR training, because we do know that for a while it was difficult to do some CPR training in person to meet those OSHA requirements. And so good faith does talk about that. We do have some toolkits that are out there for water safety instructor trainers, lifeguarding operators, and aquatic providers, and we'll talk about those in a little bit. Then we have some additional online safety information that's available for you guys to extend to your members in your communities. Water safety for parents and caregivers. Again, there's a lot of people that haven't had their kids in the water for a fair bit of time due to closures, and making sure those parents remember what some of those water safety skills and expectations are is really important. Our water safety for kids and our Red Cross Swim app. Then if you're looking for other information as well on social media, we do have training services on our LinkedIn page. We have American Red Cross on our LinkedIn. We have our Red Cross YouTube page. We have a Red Cross blog. And then I do know that we have a couple of people joining us from Canada. And although I don't have all of the information on some of the Canadian resources, I do know that there is a Canadian COVID resource page that is available also to find out a lot of information. And on our COVID page, we also do talk about the CDC page. So here's the question, right? What can I train? Who can I train? And how can I train? Those are the questions we at the Red Cross are getting daily, hourly, all day. And I get it, and I understand. What I will ask everyone to understand is that the Red Cross can't unilaterally make those decisions. We are the training entity. We're not the policy makers. So you can use a lot of the resources and the information we've gathered in conjunction with your local Department of Health guidelines and restrictions and opportunities, and work to make those decisions that work best for your facility, for your insurance, for your board, for your Department of Health, all of those entities. And they do vary not only from state to state, but also sometimes from county to county. I cover New York, which has some very specific requirements and expectations. I also cover Massachusetts and Pennsylvania, which are commonwealths, and some of those decisions are made at the county level, not at the state level. And California is another example where there are restrictions that are in place at the state level that are different from other locations. So you do need to check with your local guidelines and use the resources we have in conjunction with those conversations to make the decision that works best for your facility and for your communities. For us at the Red Cross, you're able to train with the Red Cross. We aren't stopping anybody from training. It is a local guidance that is helping to make some of those decisions. So I just want to preface that, and then let's go on to some of the information. So on the Red Cross Learning Center, we have a COVID landing page. And in there, we have it broken out by course style. I'm showing on here just the lifeguarding and the swimming and water safety. We do also have it for CPR. We do also have it for some of our other classes. We have it for our BLS and our ALS and our PALS program. We have it for all of those. So for here, we're going to talk about some of the lifeguarding and swimming and water safety. And these are all links on the actual site. They won't be a link on the deck if you get this from Jordan afterwards, but you can certainly find it on Red Cross Learning Center. But in here, it's marked by area, and then it's by date that it was last updated. So you'll see up here, we have some information. We'll talk about it, about the lifeguarding provisional certification course details. And it was just updated on February 2nd. So you'll know that it's the latest information, and what that, if it says provisional lower, you should go with the latest one. So there's certainly a lot of resources that are available. Other things that are on this COVID landing page are our overall Red Cross updates, news and updates, and this will be on the right-hand side of your page, as well as our health and safety guidance that is done. A lot of this comes from our Scientific Advisory Council to give some guidance for instructors for managing classes from our Scientific Advisory Council. Considerations for aquatic facilities and lifeguards. That becomes really important for you to take those things, use our amazing critical thinking skills, which all of us have, and be able to put that together into something that works best for you. And as well as, again, that COVID-19 landing page for the CDC. So some really good information here that's very, very helpful for you to help make some of those individual decisions.
Can I pause for 1 second and ask 2 questions?
Absolutely, Jordan.
Sure.
Yep, go ahead.
We had one question that says, how do you correct an incorrect email that I've submitted? I'm not sure what that means. So if
Is that for
getting into the
yeah, I'm assuming that's for a student. Yeah, I'm assuming that's for a student. You can either engage the TSC through the chat bot on the Learning Center and ask them to update it, or you can update that with you may need to call the TSC in order to do that. That will be a future enhancement where you'll be able to go on and adjust that email address yourself, but it's not here today. But you can just call 1-800 and they'll be able to update that.
The other question is, if my lifeguard cert is good until June, is it still extended?
No. The short answer is no. So most of our, there are no, we're going to talk about that, but there are no more extensions. Now you do still have a 30-day grace period that you're eligible for a lifeguarding review course. You cannot guard during that period of time, but we are not, as we are coming out of COVID, we are not adding additional extensions to any lifeguard certs due to COVID. So that if your lifeguarding expires at the end of June, you should still do a review class before the end of June. That's that short answer of what that is. Any other questions in the chat?
Not at the moment.
Okay, great. These are great questions and we get these all the time. So the questions are good. So in here is also some toolkits that you can use again to give you some ideas. Maybe it was something you hadn't thought about. Or some suggestions, but it is for Learn to Swim and for training lifeguards. And we'll talk about it, and I'm sure afterwards some of the other people on the panel will provide some insights as to what are being done all over the place, because it varies. I've heard of Department of Health that are approving pod training where you bring in your own people, or you're in the same group for the whole time. It varies from location to location, but there is some good guidance ideas in these toolkits. So certainly something to take a look at and your own individual circumstance and decide what's best for you and will meet your needs the best. So let's get into some of those lifeguarding certification questions and options that are in here. So we do have people that expired last summer, or they're going to be expiring in June to the point, or just the questions as to what they can train and how that can work. So you of course can always do a traditional lifeguarding course. The full course 26 hours for a pool certification, additional time if you need waterfront, you can still do that if they are new or long expired. And I would say definitely, it was 120 days, it is back to the 30 days. So I apologize that I didn't fix that on here. But more than 30 days, they can take a new course. And for some guards that haven't been in the water for 2 years, that may not be a terrible thing. And I do know some locations that are choosing that for their entire staff. However, there is time and money that goes in with that. A traditional review, if they are due to expire or only within 30 days, they can take the lifeguarding review. Please remember that 30 days is not where they can sit in the guard chair, but they are eligible for a lifeguarding review. Okay. We did have a lifeguarding extension during 2020 where they could go online, vouch for a lifeguarding extension, and that extended their cert where locally available for 120 days. I think New York was the only state that did not accept that in any way, shape, or form. So again, check with your local. However, it is no longer available. If somebody expires May 1st, they cannot go on and apply for that 120-day extension. That ended 12/31. So if they took it 12/31, they had 120 days after that to complete that review course. So yes, that was out there. Yes, it is pretty much done. And then here's the option that we have created to help you guys. And this is our provisional lifeguarding review course. So this is any lifeguard who expired from March of 2020 until June of 2021. They can be eligible for this 2-part provisional lifeguarding review. And basically all it is they're going to complete the online content and you're going to close out that blended course. That gives them 1/2 of their certification, and it's only available as a review. And if locally accepted, they could guard in the chair. Then they have 120 days or by the end of June to complete the skill session, have that entered on a separate course record, and then they get their 2 years at the end of that. So you're paying twice, but it's basically half the cost, first for the online portion and second for the CR. So again, this provides an option if they expired last June where they do not have to take a full lifeguarding class. You could have them do the provisional lifeguarding review. Again, skills need to be done by the end of June or 120 days after they completed the provisional, and local guidance will decide whether or not they're eligible to sit on the chair. But even if they can't sit on the chair in your state, it doesn't mean you can't do a provisional lifeguarding review course and shorten that time that they need to spend doing their lifeguarding class. Let me pause there. Jordan, are there questions in the chat? Because this is a lot, right? This is a lot of what the questions are.
Yeah, there was just a question. In Albany, New York, you must have full certification at JCC. I'm doing a re-certification, our local COVID guidance. I also know that maybe this is an opportunity to address the fact that everyone is having a lifeguard shortage right now, and not just lifeguard shortage, but staffing shortage in general. So maybe you want to address that a little bit, Gwen.
Absolutely, right. We're hearing it all over the place. I think it's a very multifaceted point. I know, we've seen articles from Atlantic City struggling with getting employees for their rides where they don't need a certification. We're hearing things in Philadelphia where the kids that are coming in to apply to be a lifeguard can't pass the pre-test because they haven't been in the water for 2 years, right? That's an important thing. Then I think we're early into the vaccine conversation. And I do think you have young people, young adults, parents who are maybe not quite ready to trust that they're safe to be lifeguarding and working out of the house. So my gut says we're going to start to see more applications coming out, especially from like Memorial Day to June 15th. I anticipate a little bit more of a I'm looking for a job for the summer. But we're hearing this all over the place, and it's very multifaceted, and it's complex. We do know, again, some people are making more on unemployment than they were as a lifeguard. Pay this year, I think, becomes more of an issue than it ever has in the past. Stress for aquatic directors. I was an aquatic director for 20 plus years. I know the fun, we're going to call it fun, of being on call 17 hours a day, 7 days a week, 365 days a year. I get it. And now they haven't had to do that in a while. So it is a real issue. I don't think it's going to be an instantaneous, result. I also know that some of the struggles are some people are only training their internal staff and not opening up to the community. So now those people can't find a lifeguarding class. So I understand local restrictions that help make that decision, but that is also impacting that lifeguarding course availability, which is really important. And again, we'll talk about CPS as we get to the end of that. So I'm hoping that helps a little bit, Jordan, on that. So are there other questions with regards to the lifeguarding options here?
Nope, not at the moment.
Here we go. All right, either I'm boring or I'm giving you guys what you need. So we'll take it both ways. So this goes over, I won't read this whole thing, but this reviews how to set up that blended learning class, whether it is for the lifeguarding provisional review or for any blended class, right? But again, we do have the videos that show you that, but we have some things with blended learning classes about how to make sure that you're setting up your zip code and all of those type of things. But you do the online content. And for those of you who do the lifeguarding and enjoyed the direct links are still available. So if you don't want to do the full blended where you can track them and do all that, you can still send the direct links out for everything except for the provisional lifeguarding review. You can't do it for that. But any other CPR course or standard lifeguarding class, you can still send the direct links. And then we do have for CPR, we do have the option if you wanted for a virtual skills assessment for CPR only. You do need to have the feedback mannequins, you do need to have good videos, but we do have that option and there is information available for that on the Learning Center. And then I think you guys have a presentation later on and he is going over, they are going over CPR as well. So that'll be some great things. And then once you close out the course, then the certificate goes directly to the student as long as we said, right, the email is correct for the student. And then don't forget, if for whatever reason they don't get their cert, double check if it's on get certificate. I always do Red Cross get certificate and then it takes me to the link on Google. But you can put in that information and if it's there, then your student it gets stuck in their spam folder. So certainly options to be able to do that. So the instructor, so I'm going to pause there. Are there any questions in the chat before I go on to this next section?
Yeah, there were two questions. I can't find a lifeguard instructor review class anywhere. Any provisional options for that?
Yeah, so lifeguarding instructor review, it's a great question. A vast majority of LGIs were extended to the end of August for this year in response to COVID. So, and because of the lifeguarding shortage, what I'm hearing, the scuttle that I'm hearing is that most LGIs and LGITs are focused on training lifeguards and they may not do LGI reviews until July into August because most are not expired until then. The other thing is I would really encourage it, and again, we're going to talk about class posting. People don't have to provide tell us that they're running a class. So you need to call your local places. You guys as JCCs need to talk to each other. Who's got trainings? Hey, are you doing an LGI review? And pool those resources together. Whether or not it's YMCAs or community centers or municipalities, have those conversations. I know in some areas they are having instructor and instructor trainer calls every so often. So certainly ask those questions to your community and certainly talk to your Red Cross provider, your person of me or the people that work for me, and ask them. And a lot of times they're getting a good idea as to who's running them. But I'm not really surprised that we're not seeing a lot of LGI reviews right now because pretty much everyone was extended to August. So it's a great question. Keep asking, keep pushing. And I anticipate more to start showing up. Another question in the chat.
Yeah, I think you might get to this, but if your facility is offering a class, how do you get it posted on the Red Cross site?
Yep, so we'll get to that right at the end. So I promise we'll talk about that at the end. So, and we were getting ready to talk about LGI review, so it's great. So again, this talks about this. So it for those that are trainers, it is a great thing to go ahead and offer now. Right, it is, right? You know, if you can get enough people together, there are some people that if their lifeguarding expires now, they would much prefer to keep their LGI and their base level lifeguarding combined in one expiration date. And I can respect and understand that. So if you are a trainer and you have the capacity to throw one in every so often, I would ask you to consider doing that. So, and you do have to set it up as a blended learning because they have to sign that code of conduct. So again, many of them were extended to the end of August. If you find yours was not, and look on the Learning Center, don't just look on the piece of paper that you printed out a year and a half ago. Please go on the Learning Center and double check. You can call the TSC. They are being very, very accommodating with regards to training last year. So really, they are very much understanding of that, and you should be able to have a problem with that. We are going to have a need for a lot of these this summer. It doesn't cost for the LGI review to the Red Cross. If somebody is charging, that is for their time and their facility usage. That is not a Red Cross fee. So if you are a trainer, it's not. And then the cost of the Red Cross is the $40 for the base level test out if you want to do that. And that is $0 to post on redcross.org, and we will again talk about class posting service in a little bit. And an important thing to know is on the instructor review, if you are an LGIT, so a lifeguard instructor trainer doing your review, you need to be put on 2 rosters. You need to be put on a lifeguard instructor trainer review. You also need to be put on a lifeguard instructor review. The cascade didn't work quite how we wanted it to be very honest, right? I'm not gonna lie, right? That we thought it would work, no. So you do have to be on 2 in order to make sure you have your LGI and your LGIT updated. So again, if you have not logged on to the Learning Center and looked at your certs, it is time to do that and make sure you do that. And then the only thing virtually to do is signing that code of conduct. So just a really important thing on LGI reviews on that. Any questions, Jordan, on LGI review in the chat?
Not right now.
Good. Okay, good. All right, class posting service. So again, as I said, you as providers do not need to tell us at the Red Cross when you are teaching a course. We don't know until you've entered the course record, right? And that's okay, right? I was back in the days where we had to fill out the piece of paper and send it in 2 weeks ahead, or we were in trouble. You no longer have to do that, right? So now the best way for people to find your classes is to post on class posting service. So as long as when your agreement was set up and your executive set up pricing for class posting service on your agreement, then when you go onto the Learning Center, there's a button that says post class on RCO or redcross.org. And then you enter the information. There are costs for some of the courses and some of them are free. It just kind of depends on what it is. If you are a nonprofit and you're set up correctly, lifeguarding doesn't cost anything. And then CPR does cost, or I might be wrong, lifeguard. Yeah, no, lifeguarding is free. So right, it's a win-win. This is a screenshot of what, as of yesterday, the postings in the country for lifeguarding or instructor courses across the country. It's really only 1,800 across the country. So when parents call the TSC and say, I'm looking for a lifeguarding class for my child, the TSC has to look at this map as well, right? They don't have any other mechanism to know whether or not you're running a class. Yeah, they can kind of go through maybe and see which providers are in the area, but that's not really a sure bet, right? So getting it on there is how the community is going to find your classes, and it's how people who call the TSC are going to find your courses. When people call myself or any of our sales exec, that's how they're going to find that course. So it is an option. We have had a lot of places that their classes are booming because they've started posting on class posting service. So again, as long as you have it set up in your agreement, it's automatically there, and the button for post class on RCO will be nice and available for you when you log on to the Learning Center. If it is not, you can connect with either the TSC or your sales executive, and we can make sure that the price list, for us, it's a price list. I get it. But basically that you are set up appropriately for class posting service. So, and that's it. So you're going to enter all the information. You're going to tell us where you're going to do it. You do have to make sure that you set the minimum times for the class match what is in the manual, right? Please don't enter a full lifeguarding class you're going to teach in 10 hours, because you're not. Right? I know you're great instructors, but you need to list it for the whole amount of time that is in the instructor manual. So that if nothing else, I encourage you guys to really, I mean, we have quite a few postings in the Northeast, but as you can see through the country, there are some areas where if somebody's looking for a class in Montana, it doesn't mean nobody's training. It just means that we have no way to point somebody in the direction of where they are. So any questions in the chat on class posting?
Yeah, who do you speak to find out what your agency is set up for with the Red Cross agreement?
So you can call 1-800 Red Cross, or if your sales executive, and if you're not sure who that is, again, my information will be at the end. Reach out to me. I'll make sure who it is, and I will get you in touch with them. Not a problem. I'm happy to help with that. But yes, your sales exec, so they can definitely help you set up, and or the TSC. So again, if it's not already attached to your agreement, it's a simple addendum to your agreement. And we just have you initial it, and then poof, you're all set. It's quite painless and can be done in under a day and a half at the most, depending on whoever signs it. So absolutely. Other questions on CPS?
Not right now.
Right. So yes, please go on and do that. We also want you to make sure that you guys know about your bridging options. There are a lot of programs that if you are a lifeguarding instructor or a CPR instructor, there are other programs you can bridge to and be able to offer your facility and your community more training options. So if you're a lifeguarding instructor, you can bridge over to be a first aid CPR instructor, which is, again, is another great class to offer in your facilities. You can, if you are a first aid instructor, you can bridge over to teach babysitting. Such an important program for 11-year-olds, right? It keeps them engaged in your programs just when they're starting to not be interested, and keeps them engaged until they become teenagers. So it's a great program, great rite of passage. I bet you many on this call took babysitting certification when they turned 11 years old. I know it was a rite of passage for me. But there's a great option, and our bridging is free. So if you also have staff that are, or you hire somebody and they are an AHA instructor, so American Heart Association, or they're an ASHE instructor, or they're an Ellis instructor, or a StarGuard instructor, we can bridge them over and get them with the Red Cross information. And so certainly happy to help with that. Depending on what your needs are, we can either have the TSC help you with that, or we can have one of our strategic implementation managers assist with that. So it's a great program, and I think not everyone knows that there are additional options that are available to you to expand your opportunities, both within your facility for your staff training needs, as well as for your community. It's a great opportunity to bring people into your doors for other programs and opportunities. So wanted to make sure that. Any questions?
Yep. Would like one of their WSIs or LGs to bridge to teach CPR, is that possible?
Lifeguard or lifeguard instructor?
It says lifeguard.
So a lifeguard can't bridge to teach CPR. They would have to take the CPR instructor course, and a water safety instructor I don't think they can bridge to CPR instructor. I would have to, I'm doubting myself. I'll have to do a sanity check.
Heather is saying,
But
Heather
a base level lifeguard.
only LGI. So there we go.
LGI can, CPRO I can, an EMT instructor can, right? You know, WSI is kind of a weird one there. So thank you for jumping in on that.
Gwen, we have about 10 minutes left.
Yep, you got it. Yep, almost done. So again, this was some of the bridging information. So, and then here, just some of the additional suggestions, ideas, and innovations, because again, every situation is unique, every location is different. So I wanted to make sure I shared what some of your locations are for you to find out what other people are doing. So again, your Red Cross sales executive, right? And if you're not sure who that is, please connect with me and I'll make sure to connect you with the right person. On the Red Cross Learning Center, there's a forum and it's written on their forum, and in there you can go into the different sections. On LinkedIn, our American Red Cross Training Services. There are several social media groups across the country. I know some of them in the Northeast, and they're good, and they do stuff. So just take a look at some of those. So whether they're for lifeguards or aquatics managers, there's some good ones out there, right? Always double check whatever they say, just to be sure, but it might trigger you for where to go on that one. As well as that COVID page. And I do know Jordan shared with me that you guys have a new platform being released in the coming months for you guys to be able to interact on some of those things, as well as your email discussion list for peer-to-peer communication questions. So I did want to make sure you knew, because right, we have some information, and then of course your own peers are going to talk about what they do, because what they do might be more, could have a lot of good ideas for what you can do here. So this is my information here, and I'm going to stay on and hang out as questions come on. But by all means, if you don't know who your sales rep is, by all means, reach out to me. I will make sure I get you connected with the right person if I'm not able to just solve it for you. And we can go from there. And if there are ever other random questions that go up and you can't get hold of somebody, by all means, let me know. I can't solve everything, but I can point you in the right direction depending on what it is. So I made it through, which, you know, that was surprising for me. So I don't know if there are any other follow-up questions, but again, I'm going to stay, hang out. If questions come up, we can keep going.
Yeah, we have a few minutes for questions. How can I share this presentation with my LGTs? This presentation will be posted on the resource tab on the Spot Me platform within the next few weeks. I'm hoping sooner rather than later. Usually they go in alphabetical order, so aquatics should be right up there at the top. And we'll also make sure to send them out via the email discussion list very shortly after that. So if anyone else has any questions for Gwen, you can either put it in the chat or you can raise your hand. Gwen, if you don't mind, I'll stop sharing your screen. There we go. And we'll be able to see everyone. And if anyone has any questions, feel free. Gwen must have done a really good job at answering all the questions. So, all right, I'm going to throw it back over.
It was so boring, everyone took a nap.
Thank you, Gwen. We really appreciate it. Seth's going to
no problem. I'm going to hang out.
Great, terrific. Introduce our next speakers.
Great. I'm going to do just one at a time, just to keep it simple. Our next JCC professional that's going to present is Mallory Shenker. Mallory is the Athletics and Aquatics Director for the Tucson JCC. She was an aquatics and camping professional with the Weinstein JCC in Richmond, Virginia for over 9 years after growing up in their camp, after school, and sports programs. She earned a bachelor's degree in psychology from Virginia Commonwealth University. At the Tucson JCC, she oversees the facility, staff, and program needs for all sports, recreation, and aquatic activities. If you love her presentation today, she's also presenting in Sports and Recs tomorrow, although I expect all of you to be on the aquatics one tomorrow as well, so you'll have to watch hers via video. Her love for teaching has kept her poolside with swimming lessons and practices for over a decade, and she stays committed to being a lifelong learner by adding a new group exercise in sports to her coaching resume. Welcome, Mallory.
myself.
Mallory.
Huh? There you go. That's helpful. Now you can actually hear me. So hi, I'm Mallory. I am the Athletics and Aquatics Director here at the Tucson JCC. Aquatics is kind of my main love and focus, even though I have lots of other hats that I wear here at the J. So I'm excited to talk to you guys today about what we've been doing here at the Tucson J to keep aquatics successful. So here at the Tucson J, I'll tell you a little bit about our aquatics facility first to kind of paint the picture of what we do here. So we have an outdoor 8-lane pool that is L-shaped, has a shallow end section that is shaded, which is nice for the Tucson sun. The deepest part of our pool is 5 feet deep in the center, 3.5 feet at the walls. So super shallow, not a huge depth threat there. Unfortunately, it's not great for diving practice. But in this pool, we run master swim team practice, a youth swim team, year-round USA swim team. We run group and private swim lessons along with other aquatic group exercise classes. And this is all on top of members using the pool just to swim their laps, and then families coming to swim with their children. So over the last year, our aquatics department has changed drastically, obviously with new COVID protocols and procedures that we have to keep in mind, but also our department has grown greatly. Pre-COVID, our pool was only lifeguarded from May through September. So through the rest of the year, it was a swim at your own risk facility. Because of the pandemic, we have now transitioned to having lifeguards here full-time, which is awesome. When I first came into my role, that was something I wanted to change. And I'm really glad that this pandemic, a little silver lining, was able to make that happen for us. The need for having staff on the deck is obviously important for water safety, but with the COVID protocols, we needed staff out there for sanitation purposes, as well as keeping members distance from each other and staying masked. So that was a huge change we went through this past year with growing our staff, retaining them throughout the year, and figuring out what our policies looked like from summer, fall, winter, and into spring, how things needed to adapt. With all these changes though, the one thing that has stayed, our aquatics department has actually been the most consistent activity or engagement piece for our members. Back in June, when we were able to reopen our facility, our pool was open to our members outside of camp aquatics hours, and it was able to stay open throughout the whole summer. Unfortunately, about a month after reopening, most of our other parts of our facility had to close and stay closed for about another month and a half. Fortunately, our pool was able to stay open. So we saw a huge growth of attendance and people experiencing our pool, which was really, really awesome. But again, it was the one thing that we were able to keep super consistent when we first came back post-pandemic first shutdown. I'm going to kind of just keep talking a little bit about our programs that we're running, what they looked like pre-COVID, and now what they're looking like kind of when they first came back, and if they've evolved at all throughout this year. If you have any questions about how we're running things, how registration happens, anything like that, just shoot it in the chat. And Jordan, you can shout them out. I'll take moments to pause and ask if there are any thoughts or questions. So our masters team is where I'll start first. We had masters practice in the pool 4 days out of the week, Monday, Wednesday, Friday, and Saturday, and had about 30 people in the pool for every practice, about 90-minute practices 4 times a week. So being able to accommodate that group was really tricky to be able to bring most of them back safely. Can't fit 30 people in an 8-lane pool with distancing. So we had to break up the practice into 2, cap it at 16 registrations, 2 swimmers per lane starting at opposite ends. And we're currently still at that maximum capacity. Fingers crossed that we're able to increase that number soon to get more swimmers in the water. We brought this back as soon as we were able to because our people love it. It's a huge, huge program here, and we have a really strong, committed team of people that want to keep swimming masters. So we made sure we got that back as soon as possible. Again, adjusting what the practices looked like. Instead of an hour-and-a-half practice with 30 people, there's 2 back-to-back 60-minute practices accommodating 16 swimmers. And the registration process for this had to change drastically. Swimmers registered just per month for masters and paid a one-time fee for the month. They could swim as much as they wanted or as little as they wanted. I've now changed the registration process to register and pay per swim, and we do a lump payment per quarter. And this program is so competitive for registrations. I have a tiered process of current members that are currently swimming for masters are able to register first. Then current master swimmers swimmers that are not members, because we have a select population there that we're trying to keep happy. And then I open it up to members and anybody else who would like to join the practices after that. So we're able to accommodate those folks who have been with us for a long time and want to keep the program going. They get first dibs. But that registration process was a good shift, because we're now able to accommodate everyone at different times. For example, we have some swimmers who only swim Mondays and Wednesdays. If they had registered for the whole month, that would then take up that one spot for other folks to register. So by making it individual day registrations for practices, we're able to open up the number of people we're serving. So before we had, 30 or 40 people in our master's program in total, we're now serving about 55 people. So we've actually increased the number of people we're serving, and they're able to adjust their schedules and pay for exactly what they're swimming for. So we've gotten some good feedback from them about that, even though it was a bit of a hassle and a little bit more work on my end for the registration process. It ended up, benefiting us. Any questions?
Yeah, we have 3 questions.
Go
What
ahead.
are your times for Masters Swim?
Yeah, so we are early morning. Our master's group swims from 5:05 to 6:05, and then the next group swims from 6:15 to 7:15. Saturday mornings are swimming from 7 to 8 a.m. And I added a little bit of window of time in there between those practices. That's something I was going to touch on a little later. I'll just add it in now. Adding those buffer times between practice groups or programs helps with transition and cross traffic. Fortunately, we're an outdoor pool, so we have lots and lots of deck space that we're able to help with that traffic, but adding that time frame in between helps with that kind of stuff.
What system are you using for registration?
Daxco. So we're all in Daxco here at the Tucson J. I have a love-hate relationship with Daxco. Sometimes I feel like I've mastered it, and then I'm getting a phone call that I forgot to click something, and it's not open for members to register for, silly things like that. But Daxco works really well. I had to play with what our registration looked like for it to actually be user-friendly for our members, but it's seemingly working.
I just want to plug that there's a Daxco users listserv. If anyone is interested in joining that, please shoot me an email. I'll put my email into the chat, so you can join that and you can all talk about Daxco and what's the best practice for that. One last question was, do you have dedicated pool time to run CERT classes? Someone is thinking of leaning hard into the training arena.
Yeah, so unfortunately, our facility is not the best for certifications. That 5 feet deep is the deepest part, really makes it hard to do any sort of deep water trainings and stuff like that. Our facility did host lifeguarding classes, CPR classes like that pre-COVID and a few years, honestly, prior to that. We have not brought back any sort of certifications here at the J. Just again, our pool is not super conducive for it. I personally have an LGI here in town that is super awesome that I send all of my staff to. That's currently how I've been getting everybody recertified or certified. Cool. All right, I'll keep rolling. So the next program that I'll chat about is our swim team. So we have a USA swim team that also participates in our summer league here in Tucson. We unfortunately were not able to get them back into the water until after the summer last year. The Stingrays got back into the pool in August, and that was really because we dedicated a lot of our pool space and time to Camp Aquatics last summer, and to be able to balance camp's time in the pool with member usage. Again, the pool was really the only thing we had available to members last summer, or for a portion of the summer. We held off on opening back up our swim team until we were really able to balance everything well. But since we've gotten back in the water, we have seen a really great comeback and growth of our team. Pre-COVID, we had about 125 swimmers on our USA year-round swim team, and we were anticipating a growth of about 50 more swimmers for the 2020 summer swim team season. We are currently at about 67 swimmers, which is super excellent. And we're about to have another increase of, I'd say, about 20 to 25 more swimmers for this summer season. We modeled, our USA or our master swim team and our Stingrays youth swim team are modeled pretty similarly as far as the capacities. We still have 16 swimmers per practice. We're able to cheat just a little bit with that one. If we have sibling pairs, we put them at one end of the pool together because they can be close to one another, and that's okay. So we are able to kind of mess with our capacities there with still staying safe. But again, still similar processes for our USA swim team, youth swim team, and our masters, where there's a little bit of staggered time between practice groups. Everybody stays distanced. Everyone's masked the entire time that they're on deck, unless they're in the water. So our swimmers are really great about that. They keep their masks on them to the edge of the pool, put them on the side, and then they get right back out and put them on when they're finished. For swim team, something we did as well, and this is something we did for masters. At the beginning part of the reopening process, we had lots of one-way, our building was one way in, one way out. So traffic flow was really controlled. The swim team never enters our building. They enter through a side gate that is accessible from our parking lot. So they do temperature screenings and all that and get checked in with their coaches at a gate, which minimizes traffic going inside. Just a perk of our facility being outdoors and having access from the parking lot. It's pretty awesome. Our parents drive up, say hi to the coaches, come check in and jump right into practice. So that's been really awesome. Unfortunately, our team has not participated in any swim meets. We're working on it. We're trying to get organized enough to get there. It's just a bit more of a process now. Unfortunately, I am operating as the head coach, along with 2 assistant coaches who are really the ones running the show, but I'm the behind the scenes person. So we're hoping to get swim teams on our schedule soon to get our kids competing. I know that's something that they've been missing. That's kind of it for swim team. Does anyone have any thoughts or questions?
Do you provide swim lessons to your summer camp kids, or do they just do free swim? And anyone can feel free to answer that in the chat, but Mallory will ask you as well.
Yeah, for sure. So we do provide swim lessons for our camp aquatics, and they come for free swim as well. So we balance both instructional swim and free swim. Last summer, we did run group swim lessons for camp aquatics. Our instructors were masked or had face shields on in the water, or both, depending on the skill levels that they were teaching, and or were out of the water from their swimmers. The camp counselors provided much of the physical support in the water because they were with their campers all day. It was a safer bet to have them work more closely with them than having our swim instructors that saw multiple populations throughout the day. So yes, we did provide instructional swim during this past summer, and plan to this year. We also just recently, this past month, brought back group lessons. I had been providing private lessons throughout this whole year, private and semi-private buddy, small groups, but now we've opened it up to group lessons, still keeping the capacity super small, 4 to 6 kids in each level, but running parent and toddler aquatics, preschool level classes, and learn to swim.
That's great. I welcome anyone to put in what they're doing with their group lessons, if you've brought them back or if you still haven't. And we have a few JCCs that are looking for advice on getting started with a USA swim team, or a swim team in general. Where do they start?
Yeah, reach out to your location. I'm blanking on what the abbreviation is. That's it. LSC, that's correct. Local swim counselor or something committee. So connect with them through USA Swimming. Super, super helpful here in Tucson or Southern Arizona. Heather Zick is my contact. And truthfully, I had been a USA Swim coach, I don't know, 7 years ago, and had all my certifications and was up to date. And when I had to take over as the head coach, I started all over again. So I really did kind of start from scratch with our team. Super helpful with getting all the credentials that you need for your coaches to be set up, and how to get your team registered. That whole process is super easy, but just connect with your LSC.
We have a question again about master swimming. What do you charge for drop-in for master swimming?
Great question. I just recently adjusted it. So when we first came back from the pandemic, I tried to keep the cost per swim typical to, or broken down to what they would have paid for their monthly fee. And that was $2 for members and $4 for guests, roughly. We kept it cheaper than making it more expensive. And come 2021, I was able to jack it up, and there was not by much, but I added $2 to each. So it's $4 for members and $6 for guests, and didn't hear a peep. There was no sort of pushback at all. Again, the interest and the demand for this program is so high, I could probably charge more. I could probably charge more, but we're doing just fine as far as numbers go, and budget wise, we're just as on par as we were this time in 2019 or 2020.
Fantastic. That's all the questions for now.
Okay, cool. Private lessons and group lessons, I was going to talk on those just a little bit more. So private lessons were something we really leaned into in aquatics and across the building here at the Tucson J. People wanted to come back to things, but they were nervous to be in group settings. So we really drove home the idea that private lessons are the best way to still stay active and to still stay safe. So we really, really leaned into private lessons this past season and did super well. Myself, I taught a lot of them, but I have a small team of other instructors who really handled a full calendar. And truthfully, we did better in 2020 in our winter months than we had done in the past 3 years. We usually slow down starting in October or November, depending on how cold it gets, how quickly. And we do minimal amount of swimming from about October, November through January or February. We did not really slow down this past year, which was great. And I think that was because people were starting to get eager to come back and do things. And we were really pushing the narrative that this is a safe way to keep you and your family active. So private lessons were great. And I just mentioned, group lessons are coming back strong. Our registrations for April are transcending into May. Numbers are growing. People are definitely interested in starting stuff up again. I'll mention a little bit more about Camp Aquatics. Last summer, we really focused on making sure our camp had the adequate pool space that they needed and keeping members away from the camp programming. So last summer, from 9 a.m. to 4 p.m., our entire pool was closed to our camp programming. So no members were allowed on the deck from 9 a.m. to 4 p.m. I'm going to take on the challenge. My team and I are going to take on the challenge of this year balancing the 50 to 70 kids that will be on the pool deck plus members using the pool at the same time. And that seems a little insane, but that was a situation pre-COVID. We just have to learn how to navigate and manage all of those people with the COVID protocols and precautions that we have in place. So figuring out and scheduling and managing how Camp Aquatics and other programs balance in with member usage. We are reservation based for the pool at this time and have been since we reopened. We'll likely keep reservations until the end of time. We love them, our members love them. The system sometimes isn't the best. We are operating under Group X Pro and it can get a little messy. Sometimes things can get a little funky, but if you have enough eyes on it, it usually stays copacetic. So yeah, the reservations are a great way to keep the program and member usage kind of balanced and make sure that your pool isn't overbooked and that you have got space for everybody. One last thing to mention, just the Tucson J, we've got a couple cool aquatic group exercise classes that I like to talk about. We've got a cool class called Cross H2O, which is a blend of CrossFit moves with swimming. So you get in the water and do a couple, short sprints or a couple different water exercises, and then you hop out and you're doing a round of squats or medicine ball tosses or a round of Russian twists, whatever it may be. So there's that awesome class that we offer, which has been really great for people to experience the pool in a different way. Again, lots of people started using our aquatics facility because it was the only option. So it was a great way for folks that loved our fitness center to also get a good workout in at the pool. The other really cool class that we have is called Glide Fit. I'm not sure if anyone's familiar with this, but it's that kind of stand-up paddleboard class where you attach your board to the lane lines of the pool and you do HIIT or yoga style moves to get a good workout in by being destabilized on the board. It's super fun. If you're interested in getting it into your facility, our members love it. Everyone laughs when they're doing it. It's a great time. And again, it was another class that we offered to our members that got them excited about the pool and got them there when it was the only option that we had available. And just to note, we originally had those classes on our calendar and schedule as a paid for class, but opened it up as free to members, again, just to create more options for them when we didn't have very many.
Thank you, Mallory. We do have to move on, but I'm going to put, there were a few extra questions, so I'm going to put your contact information in the chat so that people can reach out directly to you if they have any further questions.
Perfect. Thank you.
Thank you so much.
Mallory, very, very well done. Thank you. Our next presenter will be Julie Sevilla. Julie is the aquatics director at the David Posniak JCC, has over 27 years of experience teaching in South Florida. She has taught thousands of participants of every age to overcome their fears and learn to swim. One of Julie's specialties is working with children with special needs. Her passion and mission is to put an end to childhood drownings. And she is also part of the Drowning Prevention Coalition, helping to educate the community on water safety and the importance of swim lessons. Welcome, Julie. Take it away.
I am just going to pull up the presentation.
There you go. Can everyone hear me?
Yes.
Okay. Hi, and thank you for giving me this opportunity to speak. So our JCC, we reopened right after Memorial Day at the end of May. And the pool was our first part of the center that was able to reopen. So we just opened. We did not do a reservation system. It was first come, first serve. Living here in South Florida, the majority of our families, the majority of our homes have swimming pools in their backyards. So that was a huge savior for many families, being that it's so hot here in the summertime, and with COVID not being able to go out, the community pools were all closed in communities that they stayed away because they were afraid to still come back out with the uncertainty. So to start the presentation off, here in South Florida, we have water, pools, and lakes everywhere. So within the first week of our country shutting down, on a Thursday night before I went to bed, on the news, I learned that 5 children had lost, sadly, their lives due to drowning. Children wandering off, parents home working, trying to figure out how they're going to survive and live this new life that we all just got thrown into. I went to bed extremely angry, extremely sad. Have a friend that works for a local news channel, who I happen to have taught his very large family, all of his kids and nephews and nieces, how to swim over the last 20 years. So by 10 o'clock the next morning, he had a news crew out at our JCC facility, where we were able to get on the news to really express to the community keeping our children safe. I did try to upload the video. I was not successful at it. This was my first PowerPoint. But on the news, just stressing that in this crazy new world, in this crazy new time, with parents trying to struggle and juggle, keeping their job, having to work, kids running around at home, maybe one parent was still going to work, maybe you were that single parent and had to be home watching both of your children, or kids wander off. I'm a mom. I've had small kids. I had small kids once before, and kids get away, not intentionally, but and accidents do happen. And 2 of these unfortunate drownings happened in my neighborhood, within blocks from where I live. And so getting on the news to stress, somebody needs to still be vigilant watching our kids, lock the doors, make sure that you have your pool fences are closed, make sure your kids get swimming lessons. I also did a video on, with other kids in the pool from some of my coworkers while we were closed. I demonstrated a mini swimming lesson and shared it on social media to get kids, or to show to families what they can do in their own backyards. I offered to do it via social media, if anybody was interested. I did a demonstration on how to do CPR to your child. God forbid they should fall into the pool. What a parent can do while they're waiting for rescue to come to their home.
Would you like me to play the video?
You have it?
I do, yes.
Oh, you do? Thank you. I would love it. Thank you. I hope you can hear it.
Maybe you have a pool in your backyard. You know that giving your kids swimming lessons could potentially save their
The
life.
volume is low.
There's also more that you can do these days to keep your kids safe.
Are you able to turn the volume up a little?
Julie Sevilla teaches
That's
kids,
as high as it
even
goes.
some under a year old, how to swim. So when she heard various reports of kids in distress in the water since South Florida schools let out, she wanted to find a way to help.
Many parents are unfortunately home working now and trying to maintain some kind of financial stability. So kids are running wild.
Julie says the best way to keep your kids safe near water is also the most obvious. Put your phone away. Even if you're working from home, keep your focus on your kids at all times. Now, if they do happen to fall into the water, be it into a canal or in the pool, there are some quick actions you can take.
You can get empty milk jugs, clean them out, attach a long rope to them, something that can be thrown out to a child that may fall or wander off and go into a lake. If you do have a pool in your backyard, the pole that your cleaning person uses.
Finally, no CPR. And if you don't, Julie says she's glad to teach you with the help of modern technology.
I will do it for you virtually over Skype, over FaceTime.
And Julie is serious about that. She works at the David Posnack JCC. Her email is jsevilla, JSEVILLA @dpjcc.org if you want to contact her. We're going to put her info up on our website, local10.com, along with this story if you want to hear those lessons again. And of course, she will be glad to teach you from your home how you can help out your kids. We're live in Plantation right now. Clay Ferreira, Local 10 News.
Thank goodness for.
Thank you. Yeah, I was quite surprised. I didn't expect them to come out, and but it was a great story that they did, and it ran for 3 or 4 times throughout the day for about 1 or 2 days, and I didn't think it would happen, being that COVID had just happened and everybody was still learning, and it was basically the top story around the world. So it was very exciting that they came so quickly, and they felt that it was so important to get this message out to these families. Right before COVID, I had attended a water safety symposium through our National Drowning Prevention in Broward County. And this is a great slogan. So if you can see on the right of your screen, it's a handprint, it's your high five. And each finger represents one of the key elements to keeping our kids safe in and around the water. And it's supervision, alarms, barriers, swim lessons, and CPR training for parents. So this is adapted from an organization in Australia that during the water symposium, the host of the one-day water safety used this the whole weekend. High five to water safety, high five to staying alive. So I've kind of adapted it. I actually have it, that's written with sidewalk chalk in one of our little kiddie pools. And I have it as my screensaver on my computer because I think it's just a great message. It's super easy. We're not really high-fiving that much anymore because of COVID, but to a quick, easy way for parents to understand, these are so important here, especially here in Florida with pools and backyards and the lakes and the canals, that we need to have all these 5 things to keep our children safe. This was back in last April, so we were still in quarantine and on lockdown, but our deaths for children were up 70% from the year before, and this was just last May. Our numbers in Florida have gone down drastically over the years due to the education that we do in our communities, and this was just so tragic, which is why I felt it so important to get on the news as quick as I can, to spread the message for parents to keep their kids safe. So during our quarantine, what we did most of the time, most of my staff were not working. They were not too thrilled about doing Zooms or coming in for any type of training or doing anything to stay together, except for just a quick text here and there to see how emotionally that they were doing. I wanted to make sure that they were all okay. But I spent most of my days on Zooms with Redwoods, our insurance company, with the JCCA, with other aquatic organizations that I connected with through social media, as we all learned how to navigate, through and move forward with COVID, and learned so much valuable information. So going ahead and purchasing the sinkable submergible mannequins. Somebody asked a question, how much did they cost? I think he was like $1,000. His name is Lenny. We do have Travis, who is our infant, and he was about $300 to $400. So this is for my staff when we do our in-services. Instead of using each other, as rescue and victims, we now have Lenny and Travis, Trevor, sorry, that, they can save in the water. And just, as soon as we opened in early June, I just went straight into teaching swimming lessons. I didn't hold back. I didn't wait for a green light. I told my supervisor, Spencer, I said, I have a list of parents that want swimming lessons. I'm just going. And he said, great. So I am the only one right now that's doing swimming lessons here at our facility, but I am in the pool pretty much from 8:30 in the morning, 6 days a week till about 6 o'clock each night, doing 12 to 14 lessons a day when it is not raining. Mostly doing private, ranging from 6 months and up, doing small group lessons with siblings, and or if a family feels comfortable enough, coming with their own friends and making their own pod with kids that they're comfortable with or that they're socializing with more. And there was another slide, I think we lost it, but that's okay. It was just another slide of a brother and a sister doing swimming lessons together. And we do have a swim team here that practices in the afternoon. They are, we're still running our pool at 50% occupancy. We did not, like I said in the beginning, we did not do a registration system. It was first come, first serve. We didn't run into much negativity or any problems with the pool being too busy. Like I said, a lot of people stayed away or they have pools at their own homes, and people were just happy to come back out. We do service a lot of senior citizens at our facility. So, not just bringing our kids back, but our seniors desperately wanted to come back. And they're probably one of our most vulnerable population here. So this is Larry, and Larry's at the pool every single day. And for him not to come, now that many of them have been vaccinated, they're coming more frequently and doing our aquasize class. They come and do their own exercise on their own. Many came regardless, way before the vaccine was even in existence, and took their own risk just to come out and get out of the house and be social, at the pool, because it was really the only thing that they could do. Is it any, our pool is outdoors, so it is pretty warm during the winter time. We keep it at about 85 to 87. It doesn't get too cold in Florida, but we do have a few days where it does get too cold that we don't want to go swimming.
Yeah, so that's a question for the group if anyone wants to answer that in the chat. Julie, that was super helpful. If anyone else has questions for Julie, we have to move on. We only have a few minutes left in the presentation, but I will put Julie's email address, or Julie can put her email address in the chat, or her contact information. If you want to know where she got the mannequins from, I'm sure she could put that information in there as well. Thank you so much, Julie.
You're welcome, my pleasure.
Thank you, Julie, well done. Our last presenter for today is Laura Wine. Laura is the Director of Programming at the Steinberg, Omaha JCC. Sorry if I messed that up. She was previously the Director of J Camp and Youth Programming for 22 years. She studied elementary education at the University of Nebraska at Omaha. During the pandemic shutdown, Laura researched the best practices and safety measures to reopen the JCC as quickly and safely as possible. And she worked with state and county departments of health to ensure that the JCC was following all of the proper protocols. Welcome, Laura.
Thanks. So, yeah, we live in a little further north than the other two for people. So we do get winter. And so we have an indoor and an outdoor aquatic facility. Both of them have 6 lanes and both have water slide features, lazy rivers, and zero entry areas for younger kids. So running those, the outdoor pool itself needs 13 staff, lifeguards, and just even be open, have all those features open, and indoor we need about 7. So we try not to have them open at the same time, but that does not always, it's not always conducive to do that. So we have a lot of aquatic lifeguarding staff that also have to get trained. Now, luckily, we are in the state of Nebraska, and they're pretty open. So we're full on teaching all of our Red Cross classes, and they are full. We have 4 of them coming up in May alone. And that's not including just our own staff that we're trying to get certified as well. So I will tell you that our numbers, I'll be really fast because everyone really covered everything very well, but our numbers have increased back and exceeded our 2019 numbers already. I think the saying is that what everyone is seeing is true. Everyone's ready to get back out and do life the way it was before. And so we're seeing huge growth in our aquatic department. Our numbers are phenomenal. We had 120 in our group lesson in just January and February sessions, and we were up to 171 this year, this session from March to May. So that's growing exponentially. And then our privates, really, they struggled at first. I don't know why. I don't know if people were just afraid of that close contact, you know, with people. But now they're back up to, we're well over 125 in our privates as well. So for us, we are doing super well. I would say for those of you who haven't opened any of your aquatic facilities yet, reservations are amazing. I totally agree with that. So we do still have that. We don't have it for lap swimmers, but we do have it for our family swim. But this summer we're going to try it without a reservation system in our outdoor pool. We're going to see how that goes. But again, it's really that so much of it is communication and letting people know. If you're still in the process of opening your pools up and things like that, we have a ton of resources that I can share with you. Emails that we sent out, laying out exactly how it's going to look, what you can bring, if you have towel service, all of that stuff is really huge and key for opening up and making people feel really safe, that your facility is really taking all of this still seriously. Because in Nebraska, I got to be honest, and Florida's probably the same way. A lot of our people they're done and they're taking off masks as they're vaccinated, and we're still trying to take it very seriously and make sure that we're keeping everybody that participates in any of our programs here safe. So that's pretty much about it. But we still run our full camp. We're running all of our group exercise classes in the pool. We're full on, and we are busier than ever. So that's really all I got.
Great. Thank you, Laura. Anybody have any questions for Laura?
So our reservation system, we have e-fenestry, and we're about ready to switch e-fenestry. We're hoping really soon. But so we are actually doing reservations through our own website. You can do it. A company that we work through really got us going, and so we just do it. It opens 48 hours ahead of time, so people can sign up, and that's how we're doing it. But I know there's lots of options out there: Group X Pro, MindBody. We just are choosing to do it ourselves.
Great, thank you, Laura. That was super informative. And we have a few minutes before I have final announcements. So if anyone has any questions, feel free to put them in the chat for the group or for anyone in particular, or you can raise your hand by using the reactions tab at the bottom, and I'll be happy to call on you. Nothing? Okay. Well, in that case, I will do the closing announcements. Our next peer community session will be held tomorrow at 12:30 p.m. Eastern. The Zoom link's in the schedule on SpotMe, the platform you use to get in here today. The topic for tomorrow's session is customer safety versus customer service, rethinking customer response in a post-COVID environment. And Bill Kirkner, who needs no introduction, will be running that session. And Corinne Lebarsky will be first up, and she's the head of growth for Focus Health, and she'll highlight ways to capture additional revenue for your department and your agency. And then we'll be joined by Lauren Gale and by Jennie Strauss, your colleagues in the field, who will also share creative programming that's going on in their JCCs. That's what's on tap for tomorrow for Aquatics. Just a quick reminder that the virtual vendor hall will be open today from 4 to 5 p.m. Eastern, and on Thursday from 1:45 to 2:45 Eastern. During these times, sponsors will be available for live, engaging, and informative video breakouts. You'll see some product demos and have an opportunity to ask questions about how vendors' products and services can best help your JCC. If you have a trusted advising session, you were sent a link directly to meet with your advisor right after this session. JCC Cares will happen tonight, I guess this afternoon from 5:15 to 6:15 p.m. Eastern, and it's the first ever continental service opportunity. Everyone's welcome to join this partnership with Repair the World to support initiatives with Neighbor Network and VAX volunteers. With Neighbor Network, JCC professionals will connect with seniors who are experiencing unprecedented isolation as we pre-screen seniors for local services and programs. Alternatively, you can help VAX volunteers update their site with vaccine volunteer opportunities. With new vaccine distribution sites opening daily, there are critical volunteer needs struggling against a decentralized system. We'll be helping VAX volunteers with state-by-state searches to identify new vaccine volunteer opportunities. So please join us for this really important work. At JCC Association, we were able to do some of these programs in advance of ProCon, and they were super, super impactful and moving, and they were a great experience. So I encourage you before our peer community session tomorrow to connect with your colleagues and kickstart your day with our Mindful Motivator at 12 p.m. noon or 9 a.m. Pacific tomorrow. Log on for 15 minutes to set your intentions for the day and to bring your whole self to a full day at ProCon. After a brief welcome, you can choose from one of several mindfulness opportunities and breakout sessions, including meditation, movement, or goal setting, and then you'll spend 10 minutes doing just that. These sessions are sponsored by and led by instructors from Les Mills. So we hope you will all join us. And if there are no other questions, we look forward to seeing you tomorrow.